Hello, everyone. Thank you for joining today's Web Interface webinar for groups, virtual groups, and APM entities. CMS is hosting 2 transition webinars for groups, virtual groups, and APM entities, including Shared Savings Program ACOs, that have been reporting data for the quality performance category through the CMS Web Interface and will transition to using a different submission mechanism for future years of the Merit-Based Incentive Payment System, or MIPS. During this webinar, CMS will provide information regarding other available options under MIPS to report data for the quality performance category. Now I will turn it over to Lisa Marie Gomez at CMS to begin.
Welcome everyone, and thank you for joining us today to discuss transitioning to alternative reporting options. I'm Lisa Marie Gomez of CMS, an expert on the CMS Web Interface. Next slide, please. This is a disclaimer slide for this presentation. Information in this presentation is current at the time of publication. Next slide, please. Today we will review reporting requirements for alternative reporting options. We will review measure concepts and how to select measures, and we will also discuss next steps for getting started with a third-party intermediary. Some of the information presented today was discussed during the transition webinar held on February 2nd, 2022, but please note that these are important topics to highlight as you begin to transition to alternative reporting option. Next slide, please. Now I will provide background information regarding the transition to alternative reporting options. Next slide, please. In calendar year 2022 Physician Fee Schedule Final Rule, we finalized policies to sunset the CMS Web Interface as a MIPS collection and submission type. The 2022 performance period will be the last performance period that groups and virtual groups that are reporting under traditional MIPS can report quality data to the CMS Web Interface. So starting with the 2023 performance period, these groups and virtual groups will need to use an alternative option for collecting and submitting their quality data. The 2024 performance period will be the last performance period that the Medicare Shared Savings Program ACOs reporting through the APM performance pathway, or also known as the APP pathway, can report quality data through the CMS Web Interface. So beginning with the 2025 performance period, Medicare Shared Savings Program ACOs will need to use alternative options for collecting and submitting quality measures required by the APP. Please note that the policy to sunset the CMS Web Interface doesn't affect the 2022 performance period or the 2022 data submission period that begins on January 3rd, 2023. The policy relates to quality data collection that begins with the 2023 performance period and its applicable 2023 data submission period, which starts January of 2024. Next slide, please. Now I will discuss the objective of today's presentation. Next slide, please. In order to prepare groups and virtual groups for sunsetting of the CMS Web Interface under traditional MIPS, beginning with the 2023 performance period, today during today's presentation, we will provide an overview of traditional MIPS quality performance category requirements outside of the CMS Web Interface. We will review measure concepts. We will discuss how to select MIPS quality measures to report, and we will also discuss how to work with a third-party intermediary and how to select a qualified registry or qualified clinical data registry, or QCDR. Next slide, please. Now I'm going to discuss the reporting requirements outside of the CMS Web Interface. Next slide, please. So to meet the quality performance category requirements, you must select at least 6 measures, including at least 1 outcome measure. If there isn't an applicable outcome measure, then you report on a high quality measure, or you choose a defined specialty measure set. And if the specialty set has fewer than 6 measures, the expectation is that all measures within the set are to be submitted. You can report a combination of measures within several collection types, so such as ECQMs, MIPS CQMs, QCDR measures, and CAPS per MIPS survey measure. And this will allow you to meet the minimum recording requirement of 6 quality measures. Next slide, please. Now I'm going to discuss data completeness and some other reporting requirements. So with regard to data completeness refers to the volume of performance data reported for the measure's eligible population. When reporting a quality measure, you must identify the eligible population or denominator as outlined in the measure specification. To meet data completeness criteria when reporting as a group or virtual group, you must report performance data or performance met or not met or denominator exceptions for at least 70% of a group's eligible population, again, which is a denominator, across all payers for each selected measure. For ECQMs, MIPS CQMs, and QCR measures, you, or a third-party intermediary, you identify the eligible population in your submission according to the Quality Reporting Document Architecture, or QRDA3, or the QPP JavaScript Object Notion specifications. Incomplete reporting of a measure's eligible population or otherwise misrepresenting a clinician or group's performance, and let's say only submitting favorable performance data, commonly referred to as cherry picking, wouldn't be considered true, accurate, or complete, and may be subject to an audit. Now I'm going to discuss case minimum. So case minimum means for a measure to be scored, a measure would need to have a minimum of 20 denominator eligible encounters. Now I'm going to turn the presentation over to Jamie Welch for a review of measure concepts. Jamie?
Thanks, Lisa Marie. Next slide, please. We are going to do a high-level review of measure concepts. The first measure concept we will discuss is the denominator, and the denominator refers to the criteria that includes patients into the measure to determine if the quality action was performed. The next concept is the denominator exclusion. This refers to the criteria that removes the encounter or patient from the denominator before determining if the quality action was completed. Exclusions are more absolute, where the quality action is not applicable and would not be considered for a population. There are some measures that do not contain denominator exclusions. Therefore, we always recommend to review the specific measure specification of the measure chosen to be reported. Additionally, it is important to review the specification within the collection type being used to report the measure. We'll now discuss the numerator, and the numerator refers to the quality action being measured within the specification. The numerator may contain 3 numerator options. The numerator will always contain a performance met option, and this represents performance, what the intended performance of the measure that you'll be reporting. There will always be performance not met, which represents the lack of performance for the measure's quality action. The measure may contain denominator exceptions, and the exceptions permit the exercise of clinical judgment and imply that the treatment was at least considered for each eligible patient, such as medical reason, patient reason, or a system reason. The last concept represented on the slide is a discussion about inverse measures. Inverse measures are measures that are measures where a lower calculated performance rate indicates better clinical care or control. In this instance, the representation of that quality within the better outcome for quality is represented within performance not met. Therefore, when you report performance not met, your performance rate will trend closer to 0, which actually represents the optimal clinical care intended for by the measure. We have concluded our high-level review of the measure concepts. Remember to always review the specific quality measure specification within the selected collection type to ensure you report the measures correctly. Next slide, please. Thank you. This slide contains images for some of the measure concepts already discussed. These images represent the measure concepts as they would be seen within Medicare Part B claims and clinical quality measures, or CQMs. Here you will see the denominator. The denominator contains a statement about the intended patient population. Below the denominator statement are the specific criteria that helps identify the intended patient population. The denominator criteria may contain patient demographics, such as age. It will always contain encounter information, which is usually identified using CPT codes. And it may sometimes contain ICD-10 diagnosis codes. The second image underneath the first is the denominator exclusion. This measure concept will always follow the denominator criteria and provides criteria that excludes patients from the denominator. It will be very specific in the criteria that is used to determine whether or not that patient actually meets the intent of the measure being reported. Next slide, please. Next, we'll go over the image for the numerator as found within Medicare Part B claims, or CQMs. You will also see that the numerator contains a statement outlining the quality action to be assessed within the measure's intended patient population or denominator. Below the numerator are the applicable numerator options. In this particular example, you'll see that there is no denominator exception, just performance met and performance not met. Again, it's always important to reference or refer back to that specific measure specification to ensure that you accurately report the measure. Additionally, within this image, you'll see a reference to an inverse measure, and this is how this concept would be identified within the measure specification. It generally provides very detailed information about how this measure is to be reported. Now I will hand the remainder of this presentation to Claudia.
Next slide, please. Electronic clinical quality measures, or ECQMs, use data electronically extracted from electronic health records or health information technology systems to measure the quality of healthcare provided. This slide displays a snippet of the ECQM version of the diabetes hemoglobin A1C port control measure, displaying the population criteria in the narrative or header section of the ECQM. On this slide, you can see the initial population, denominator, denominator exclusions, and numerator criteria listed in the narrative section of the measure. A measure concept specific to ECQMs called out on this slide is an initial population, which refers to the cohort of patients from which to select the denominator population. In this measure, the denominator equals the initial population. ECQMs contain three main sections: a narrative header, a logic section, which provides the technical representation of the population criteria, and the associated terminology or coding section. ECQMs are written in standard electronic formats using healthcare IT standards such as Clinical Quality Language, or CQL, Quality Data Model, or QDM, and Health Quality Measure Format and QRDA, Quality Reporting Document Architecture. For more information on ECQMs, please visit the ECQI Resource Center at ecqi.healthit.gov. Next slide.
Great, thanks, Claudia. So now I'm going to discuss measure selection. Next slide, please. To become familiar with the specifications in advance of the 2023 performance period, please review the following resources: the 2022 ECQM specifications, the 2022 MIPS CQM specifications and reporting documentation, the 2022 QCDR measure specifications. You want to select measures that are applicable based on the type of care your group, virtual group, or APM entity provides. Your group or virtual group can continue reporting many of the same quality measures reported through the CMS Web Interface, or can select and report other quality measures that better represent your scope of care. 2023 ECQM specifications will be available to review in May of 2022. The 2023 MIPS CQM and QCDR specifications will be available in December of 2022. There are 200 MIPS quality measures available to report for the 2022 performance period of MIPS. The MIPS quality measures are available through different collection types. Next slide, please. You can search for 2022 resources on the QPP resource library by filtering by performance year. So for example, 2022 or 2023, or by filtering by performance category, for example, quality or cost, and by resource, for example, measure specifications. You can also search using keywords. Next slide, please. The 2022 measures list, shown in the screenshot here, can be used to identify applicable measures. The measures listed include the available collection types for each measure, including those measures that are equivalent to the CMS Web Interface measures, measure type, such as outcome, intermediate outcome, process, patient experience, etc., and specialty sets associated with each measure. You can sort the measures list on any of the columns, including by collection type, to determine which option may be most applicable to your group based on the type of care you provide. Groups and virtual groups can use the 2022 measures list as a reference to prepare for the 2023 performance period. However, currently available measures are subject to rulemaking and may change. Please reference the 2023 quality measures list, which will be available in December of 2022 to make your final measure selection. Next slide, please. This table displays 2022 CMS Web Interface measures with ECQM and MIPS CQM equivalents. Although there are measure equivalents, the measure specifications are different. Review carefully in order to ensure you are capturing quality data properly. Next slide, please. When you select 2022 ECQM specifications, the link on the QPP resource library, you'll just want to make sure that when you see this list, you will see that there are the listings, and when you make your selection, you just want to make sure you select the one you actually want to do, which will be, let's say in this case, an ECQM. Next slide, please. To access measure-specific information such as specifications, logic, and coding requirements, click the hyperlink measure name, and that is outlined in red on this slide. Next slide, please. To access measure flows from the Electronic Clinical Quality Improvement Resource Center, you want to click the ECQM resources, which is highlighted in red, and then you'll want to enter flows as a search term. Next slide, please. For MIPS CQMs, you can use MIPS CQM single source Excel documents, which is a resource within the 2022 MIPS CQM specification and supporting documentation. The MIPS CQM single source Excel documents identifies HCPCS, CPT, and ICD-10 CM codes associated with each MIPS CQM that map to the denominator and numerator information in the specification. To find applicable measures, filter on the codes you commonly use when treating patients. The results will be a list of measures that may be applicable to you. The measure ID corresponds to the quality measure ID, or measure number. You can then review the measure specifications to determine if it's a good fit for your group or virtual group. Please note that there are 3 separate single source documents within the 2022 CQM support documents. If using the single source to determine which measures are applicable, we recommend utilizing all 3 documents. If you need assistance determining which MIPS CQMs may be applicable, please reach out to the Quality Payment Program Service Center at qpp@cms.hhs.gov. Next slide, please. Now I'm going to discuss next steps pertaining to third-party intermediaries. Next slide, please. As groups and virtual groups select quality measures and collect data for each measure, you'll need to consider if you'll submit them on your own. So you'll submit your own quality data, or you'll work with a third-party intermediary to submit data on your behalf. If your group or virtual group decides not to work with a third-party intermediary, your group or virtual group will need to ensure its Certified Electronic Health Record Technology, or CERT, is updated to capture data according to the 2023 specifications for the ECQM you select. Your cert needs to be updated prior to the start of the performance period to ensure you're able to meet the data completeness requirements by capturing performance data for 70% of denominator eligible encounters for each ECQM you've selected. You'll need to consider reporting MIPS EQMs or QCDR measures if your virtual group or virtual group's EHR isn't certified or isn't on track for the 2015 edition certification. Next slide, please. QCDRs and qualified registries are vetted and approved by CMS to support data collection and submission of quality measures, promoting interoperability measures and improvement activities on behalf of a group or virtual group. QCDRs and qualified registries are required to support all MIPS performance categories that require data submission, with some exceptions for the promoting interoperability performance category. QCDRs and qualified registries provide performance feedback at least 4 times a year. The feedback can help drive practice improvement and alert groups and virtual groups of the changes needed in workflows or processes to improve performance prior to submission. CMS publishes a list of approved organizations with information such as contact information, services afforded, pricing, and specific quality measures and/or QCDR measures that they support. And this is, again, prior to the start of the performance period. So we encourage you to review these resources. Next slide, please. Generally, the population of approved QCDRs and qualified registries is fairly consistent from year to year. We encourage groups and virtual groups to review the 2022 qualified postings to become familiar with the costs, services offered by approved QCDRs and qualified registries. The 2022 qualified clinical data registries, qualified posting, and 2022 qualified registry qualified posting are available now. The 2023 QCDR qualified posting and the 2023 qualified registry qualified posting will be available in December of 2022. The QCDR qualified posting and qualified registry qualified posting are updated throughout the year to identify QCDRs and qualified registries that have been placed on remedial action and/or terminated. Just want to note that a QCDR or qualified registry can be placed on remedial action and/or terminated if CMS determines that the organization isn't compliant with CMS requirements or has submitted inaccurate or otherwise unusable data. If such type of entity is placed on remedial action, the QCDR or qualified registry must submit a corrective action plan addressing any deficiencies and outlining steps to prevent reoccurrence. Next slide, please. To quickly find qualified postings within the QPP resource library, filter by performance year and type qualified as a key term. Next slide, please. The following are best practices for finding the QCDR or qualified registry that's right for your group or virtual group. Start by searching for QCDRs and/or qualified registries that support the MIPS EQM your group or virtual group that they selected. And let's say you're not using a third-party intermediary to support data collection for all quality measures or specialties. So once your group or virtual group has identified the QCDR or qualified registry that supports the selected MIPS EQM, you can evaluate such third-party intermediaries based on costs and services afforded, including how you'll get your quality data to them. For example, if your group or virtual group has multiple EHR systems, you may need to search for QCDRs and/or qualified registries that offer data aggregation services. You want to contact the QCDR or qualified registries to begin contract discussions and/or commit to a specific QCDR or qualified registry. At this stage, you will work with your QCDR or qualified registry to begin participating with a third-party intermediary. You will review the 2022 MIPS guide to using a QCDR or qualified registry for more information. Next slide, please. The next few slides will outline available resources. Next slide, please. If you need additional assistance, please refer to the contact information listed on this slide for the Quality Payment Program Service Center and the Shared Savings Program. Next slide, please. You're strongly encouraged to review the newly posted transition resources available on the Quality Payment Program Resource Library. The CMS Web Interface Transition Guide provides a comprehensive overview of traditional MIPS quality performance guide requirements outside of the CMS Web Interface. It also outlines alternative options for quality data collection and submission in traditional MIPS. It outlines key elements and timelines to consider as groups and virtual groups prepare for the transition of meeting traditional MIPS quality reporting requirements using an alternative reporting option. Next slide, please. This is another CMS Web Interface transition resource, which is Getting Started with ECQM, which provides step-by-step instructions for transitioning to an ECQM reporting. Next slide, please. This last resource, in terms of CMS Web Interface transition, this resource in particular outlines MIPS EQMs, and it describes processes for transitioning to a MIPS EQM reporting. I just want to note that we encourage all of you to continue to review the CMS Web Interface transition guides and resources that we've developed, and these have been developed specifically to provide step-by-step and information in a manner that is easily for you to go in and know exactly what you need to do in order to have a successful transition. I just want to thank everyone for joining us today, and we hope that these transition webinars have been useful for you. And again, the recordings and the transcript and the slide deck will be available for today's call within the next few weeks. Again, thank you again for joining today, and we hope you all enjoy the rest of your day. Take care. Bye.